Hello, I'm Dr. Paul Byrne, a pediatrician and neonatologist. Do you want to be an organ donor? Odds are you haven't given a lot of thought to this question. While most adults and teenagers do not think much about such things, be sure to know that at the License Bureau, whether you are a first-time applicant or renewing your license, this question will be asked. But how much information about organ donation and determination of death do you have to answer this question? To make an intelligent, educated, and informed decision, you must think about life and death. When we go to a wake, we see a corpse, a dead body. If an organ would be taken from that dead body, it would not be suitable for transplantation. Organs for transplantation are taken from a patient with a beating heart and circulation of the blood. If you say yes to organ donation, you're giving permission to the transplant surgeon to stop your beating heart and take it out for transplantation. To answer the question, do you want to be an organ donor? You need information about brain death and how it differs from the dead body at a wake. The patient declared brain dead is on a ventilator. To declare brain death, the ventilator is stopped for as long as 10 minutes to see if the patient will take a breath on their own. A person is alive until dead. Sometimes a person seems to be close to death and is said to be dying. However, a person who may be close to death is still living and not dead. At death, the soul separates from the body, leaving on earth the dead remains, a dead body, a body without life, a body without a soul. This information can be helpful in many ways, but especially at the License Bureau when you're asked, do you want to be an organ donor? To begin, I will tell you about baby Joseph, the patient who caused me to investigate brain death and related issues. This is a photograph of baby Joseph. He was born prematurely. He's very small. You get some idea about how small he is by this adhesive tape, a half an inch wide. This is the ventilator connected to Joseph, supporting his life. When Joseph was on a ventilator for quite some time, he wouldn't move, he wouldn't respond. A brainwave test was done. It was interpreted as consistent with cerebral death, repeated and unchanged. It was suggested to stop treating him. I continued to treat him. This is a photograph of Joseph when he was 7. At school, he got good grades. Later, he married and has 3 children. Joseph, and every human person, is one specific human person living on earth. The person is soul-body unity. There's a oneness to the person. Every cell has DNA specific for this particular person. The cell is the basic unit of biology. Groups of cells make up tissues. Groups of cells and tissues make up organs. Organs are integrated as systems. In the human body, there are 11 systems. 3 are vital systems. The interdependence of systems is a sign of the soul-body unity of the person. Life on Earth is somewhat like a line that can be drawn. It has its beginning, it's continuous, it has its ups and its downs. And there are times when there are bumps in the road. There are important events in life. Birth is an important event. Graduating from high school, getting married is an important event. The event at the end of life is called death. The living body, the living person becomes changes to the dead remains. To live on Earth, there has to be an intake of oxygen, water, and food. There has to be output of urine, stool, and carbon dioxide has to get out. A normal temperature. For life on Earth, structure sufficient for the soul-body unity is necessary. Interdependence of circulatory, respiratory, and nervous systems is a sign of the soul-body life of a person. No single organ, not even the brain, is the integrator of the body. The respiratory system is very important. The respiratory system is composed of the trachea, the lungs, and the blood vessels. It's there for oxygen to get in and carbon dioxide to get out. There are four components of respiration. One is the movement of air in and out of the lungs. The ventilator only moves the air in. The second one is transport of oxygen and carbon dioxide across the lungs into and out of the blood. This is called external respiration. Number three, the circulation of the blood with oxygen and carbon dioxide to and from the body tissues. And the fourth one is exchange of oxygen and carbon dioxide from the blood into the tissues and the cells. This is internal respiration. Carbon dioxide is a waste product of metabolism. It's picked up and circulated in the blood to the lungs to be exhaled. The exhalation of carbon dioxide after the breath in is what happens whether the breath is by oneself or a ventilator. The ventilator is life-supporting. It delivers air in, nothing more. The ventilator does not do respiration or circulation. Respiration is exchange of oxygen and carbon dioxide in the lungs and via the circulation in all tissues of the body. The ventilator only delivers air. Respiration is done by the living person. The ventilator does not work on a cadaver. The beating of the heart is intrinsic to the heart. The ventilator supports oxygen going into the body, but does not make the heart itself beat. When someone goes from being healthy to not healthy, this can be caused by not enough oxygen, not enough water, not enough food. Diseases happen, overdose of drugs, toxins, poisons, sometimes trauma. With these, there's altered functions and sometimes altered structure. When not breathing, the ventilator is needed to support life. One cause of not breathing is cessation of brain function. Cessation of brain function and altered functions is not death unless there is destruction sufficient that the soul-body unity is no longer. Death is the cessation of life on earth. It's the separation of the soul from the body, manifest as destruction. At death, there's separation of the soul from the body. The cessation of life on earth is what happens at death. At death, the soul separates. The structure of the living body is changed to the dead remains. When dead, there's a change in structure that is manifest as destruction. The cessation of functions is due to destruction. After death, what remains on earth is a dead body, the remains, a corpse, a cadaver, a body without life, a body separated from the soul. The question is, how much destruction is sufficient to be declared dead? The answer is sometimes it's obvious when there's dynamite or a nuclear blast. Sometimes, initially, it can begin at the microscopic level, but this is not practical for the practice of medicine. The person cannot be declared dead when there's evidence of life, when there's a beating heart and circulation and respiration. Rigor mortis eventually occurs, but rigor mortis or stinking is evidence of destruction, but while sufficient, it's not necessary to determine death. Death is destruction, but what is sufficient destruction of cells, tissues, and organs so that the interdependence of the systems cannot exist? At death, cells, tissues, and organs of three vital systems have been changed to remains. There cannot be destruction of the circulatory and respiratory systems while the heart is beating with circulation and respiration in the body. By respiration, we mean gas exchange, oxygen in, carbon dioxide out, even if the life-supporting ventilator is used. Brain death, also called neurological criteria. Criteria are observation by which one can make a judgment. The criteria for brain death are primarily bedside observations. They're not sophisticated tests or images. The patient is on a ventilator with a beating heart and circulation. This is preceded by trauma, sometimes a lack of oxygen. Overdose of drugs is now a common way that organs are obtained for transplantation. The clinical tests for cessation of some brain functions are three. One, no response to pain. It's then said the patient is unconscious and in a coma. The second one is no response to brainstem reflexes, to certain tested brainstem reflexes, but not all are tested. And then there's the procedure of the apnea test when the ventilator is disconnected from the patient. What's not required and sometimes used is an EEG. It's not required, but there's no reason not to do an EEG. It's also not required to do CAT scans or MRIs or blood flow studies or angiograms or ultrasound. However, the images and the scans, when done, are often reported as no observation of circulation. It's important to know no observation of circulation is not evidence of no circulation. No observation of circulation is not evidence of no circulation. In the procedure of the apnea test, the ventilator is disconnected for up to 10 minutes. Normal carbon dioxide is about 40. The carbon dioxide is increased to 60 or sometimes 20 above the baseline. The increase in carbon dioxide in itself can cause sedation and brain swelling. The patient must prove during this time off the ventilator that he or she can take in a breath without the ventilator or will be labeled brain dead. Then it's legal to stop the beating heart, to cut out the heart and other vital organs. Giving oxygen does not protect the patient from high carbon dioxide. You have to learn, say no, no, no to the apnea test. The patient declared brain dead, has a beating heart, circulation, digests food, makes urine, maintains their own body temperature, wounds heal, they fight infection. When they get infection, they get fever. When they're cut into to get their organs, the heart rate and blood pressure increase. Neurological criteria consider all of these as not meaningful to being alive. None of these happen in a cadaver. When the treatment of a brain-dead pregnant mother is continued, the mother and baby continue to live. The longest reported in the literature is 110 days. Brain death is not true death. The tests when determining brain death are for altered functions, not destruction of even the brain, much less destruction sufficient for death. The law calls for irreversible cessation of all functions of the entire brain, but only some functions are tested. No observation of response is not evidence of no consciousness or destruction of the brain. Excision of organs begins while the heart is beating with circulation and respiration. Do you want to be an organ donor? Organs for transplantation are taken from patients who are relatively young, less than 40. There's altered brain functions, but they have circulation and respiration. They're called brain dead, but not dead. Also, organs are taken from those that are called heart dead. What are these patients? They're, again, relatively young, less than 40. They have a functioning brain, and they also have beating heart and circulation, but the desire is to get their organs. So what happens? The life-supporting ventilator is taken away. When there is no pulse, and that means not necessarily no beating heart, for 75 seconds or 5 minutes or 10 minutes, they're declared heart dead, not dead. The 75 seconds is reported in the literature. 2 babies in Colorado, when the ventilator was taken away and their heart went without a pulse for 75 seconds, 1 minute and 15 seconds. That was the signal to have their beating hearts cut out. Tissues for transplantation, take note, tissues are different from organs. After the organs are taken, tissues are ligaments, tendons, skin, cornea, and heart valves. These do not require circulation and oxygen as the organs do. Thus, without oxygen and circulation, tissues are not damaged as quickly as organs. Take note, the cornea gets oxygen from the environment. There's no blood supply. Thus, the cornea can be taken several hours after there's no circulation. A living donor is also can be an organ donor. The living donor is healthy. The living donor can give one of two kidneys, one lobe of two lungs, or part of a liver can be taken. However, it's necessary that full and complete information about the effects of donation on both the donor and recipient are necessary for both the donor and recipient to give informed consent. When treatment of a brain-dead patient is continued, the person can live for an extended period of time. Joseph, I told you about. TK is a patient that I took care of who lived about 20 years after the declaration of brain death. Jahai lived more than 4 years after the declaration of brain death. Alan, he continues to live. He lives at home with his mother and father and brothers and sisters. Zach Dunlap, a young man who was injured on a four-wheeler, was declared brain dead, and the helicopter was landing to take his organs when a relative did one more test and got a response, and the procedures of organ transplantation stopped. All of these patients had a relative or someone who speaks up to protect the life of the person. They instructed no to the apnea test, and if the apnea test had already been done, it was no to a repeat apnea test. The declaration of brain death requires no respiration, no heartbeat, and no circulation, and this has to be due to destruction of the organs and tissues of the three vital systems. The recommended model statute is no one shall be declared dead unless the respiratory and circulatory systems and the entire brain have been destroyed. Such destruction shall be determined in accord with universally accepted standards. This is solidly based medically and ethically. You can obtain a card from Life Guardian Foundation that is called a medical opt-out card. It's there to protect and preserve your life. The first thing it says is, I direct all medical treatments and care, including nutrition and hydration, however administered, be given to protect and preserve my life. Do not hasten death. Do not do an apnea test. Do not take any organ for transplantation or any other purpose. You can make such a card yourself, laminate it, and carry it with you. The soul is the life of the body. When dead, it's a body without a soul. Cessation of functions is due to destruction. Lack of function alone is not evidence of destruction. Evidence of destruction such that there is no longer interdependence of the respiratory, circulatory, and nervous systems with focus on the brain. How much destruction before death is declared? No one ought to be declared dead unless respiratory and circulatory systems and the entire brain have been destroyed. When declared brain dead, taking of organs begins while the heart is beating with circulation and respiration. Do you really want to be an organ donor?